Hello everyone, this is Abhijit and welcome to Abhijit Archives. Today I have with me a very special person who has cleared the Plab exam and he will be working in King's Hospital, London, which is in the UK. More about him from his own words.
Okay, so thank you Abhijit for this hype thing. So I'm Dr. Siddharth Murekar. So I'll be working as a junior clinical fellow in trauma and orthopedics in King's College Hospital, NHS Foundation Trust, London. Apart from that, I was a ex-clinical attaché and in general surgery as well as in trauma and orthopedics. I was also clinical attaché in Queen Elizabeth Hospital in neurosurgery. Before that, I had actually gone to UK for giving my Plab exams, which I'll tell in brief in some time. Apart from that, I am a director in R&D, Research and Development in Youth Cancer Action, which is an NGO which supports cancer research and it helps to provide the basic utilities such as cancer approach, basic treatments to the needy people all over India, and it has many members all over the world as well. I am also a member of R&D in Lexicon, which is a medical writing journal. I was working as a volunteer in Plabable, that is one of the biggest Q bank, like question banks in the Plab journey. I was working as a medical officer, full-time medical officer in Civil Hospital, Wardha.
Which is, by the way, my
hometown. Yeah. So we didn't meet there, by the way. We met in Nagpur only. So yeah, I was working there, and before that I graduated. So yeah, I completed my internship. So what I can tell you is that I am MBBS graduate and we all are at the same level. Okay, I know you are watching me. I'm sorry, you are watching me and thinking that why is he here and he's shooting, he must be someone big or something, because Abhijit is super famous. It doesn't count that. We all are at the same level. And it's just that I did something and I wanted to share with all of you. And I know you are watching me and watching Abhijit at this time. I'm sure it will be helpful for you.
You are from Medical College Zargaon, right? So what is this journey going straight from Zargaon into UK King's College London?
So Abhijit, I'll not lie, I was a bit overwhelmed at this time because it is a big thing for me as well, and I think so for many of us. So I had this little obsession of going into King's, at any level. Frankly, I was ready to go at any level in King's, not as a working there. I just wanted to be in King's, be in that environment, be with the people who work at King's. And so it was really big because I graduated and within 2 years, I can say, sorry COVID, 2 years for you. So in 2 years, actually, I will be working at King's. So that is a big thing for me. It was a bit overwhelming, but what I can say is we grow through what we go through. So whatever experience I had has helped me to be what I'm here at this time.
That's a very inspiring story. You went from Zargaon to King's London. You cleared Plab exam. You achieved so many things. Where did it all start? Where did the spark light up in your heart?
So what I can say is, see, there are many people who are at my stage and there are many people who have the same doubts. Like Abhijit has this, what you did actually, right? So frankly, I'll be frank with you guys, okay? And I don't know whether Abhijit will cut this or not, but I'll be very frank with you. So even just at the end of the internship, I was just completing my internship, and that time I even didn't know what is a full form of Plab, okay? Abhijit, I'm not lying, okay? I didn't know the full form of Plab in January of 2020. I literally Googled it. So what is Plab? Okay. And then I tried to pursue this, what's this and all this. So in the journey, I'll tell you about it firstly. So I graduated in March 2020 with my internship. And by that time, I had this very strong direction that I want to pursue Plab, okay? I will tell you after some time that why didn't I go for MLE or Australian Medical Council or Canadian Medical Council like that exams. For now, so I was sure that I will pursue Plab. If not, I'll go for NEET PG. So this is the common query everybody has. Why not NEET PG and why Plab, okay? So firstly is where I graduated, and thanks to COVID, we were all at home. I didn't have to run anywhere. I was at home in front of this desk, okay, and internet in my hand and Google with me. I read 3 months. I can say that I did a very deep research about what are the things. I tried to contact people. I made a lot of social connections over Facebook and Instagram and something like that. So I read about this Plab pathway and what are the perspectives, what are the chances of getting into Plab, what is Plab and how to get into residency. Everyone at the level of completion of internship has these 2 questions. What next? Okay, doctors are never satisfied. MBBS, we are done with MBBS. We still need PG. PG ho gaya. Then what we'll need is super specialty and all this thing. So I too had all the same questions like you, and everybody has that. So I did research on that. So why not Plab actually? Firstly, it was why Plab, okay, and then after 3 months of reading, I was like, why not Plab? It's a good pathway.
So you decided to go into Plab right after your internship in March 2020.
Yes.
I won't ask you about your journey because it is full of COVID obstacles. I want to ask, if I want to pursue Plab, what is the simplest way I can go through? Please guide me with your experience that you gained through it.
Yes, this is a very valid question because I was really like searching for what should I tell, okay? So one thing I'd like to add before answering your question, okay, Abhijit? So it's like COVID, maybe I know that COVID was a really bad time for all of us, but frankly, personally, COVID made me realize that how important things are. What is the importance of one life, okay? Because I've been working at very grassroots level during COVID. And I realized that what is the true value of life when I saw patients at very debilitated conditions and I had to take the decisions of life or death for them. Then I realized that whatever doctor I will be a good doctor. I don't care whether I'll do PG or, PG, 3G, 4G, something kind of stuff, but I'll definitely be a good doctor. So doing Plab was one of the main reasons that I want to value personal life, okay? It's not that I'll be working 24 hours. I'm not like that person, okay? So keep me apart. If you are wanted to work 36 hours straight, I can't work like that. I'll work now well. I'll work like anything when I'm working, and after that I'll have a personal life, because during COVID taught me that what is the importance of one personal life, okay?
Like one of the advantage of Plab is that you can value your personal life equal to your life as a doctor.
Very, very important. So there is a big misconception in India that more you work, the better doctor you are. I don't agree with it, okay? All these things are my personal opinion. I feel if you are a good doctor, you will be a good doctor. It doesn't make you want to work for 48 hours straight or 60 hours straight just so that you want to be a good doctor. It just takes a toll on one's mental and physical health, which is one of the very important reasons nowadays, that the importance of mental health, if I'm not wrong actually. So one of the reasons was I wanted to balance my personal and my professional life. I can't work all the time. So that was one of the reasons. Also, not only that reason, Abhijit, Plab also helps you to explore your fields, and I didn't want to rush in. So generally, as at my level of internship, I want to give a NEET exam, which I already did, and I want to get into a residency. If I get into a residency, I have to be married to that residency, right? I can't change that. And once you are in 3 years of residency in India, it's very difficult even to change your specialty, right? You can't invest more 3 years in all this. Like maybe there are some people like you who feel that I was a bit immature to commit to some specialty so early in my life, okay? I wanted some time. So now only at my level, I took this 2 years to realize that no, I want to do surgery, okay? I love surgery. I have worked a lot in surgery in UK as well now. For 2-3 months I worked there intimately. And now I'll be starting in trauma and orthopedics. It's like I will be exploring trauma and orthopedics. I won't be committing to it at this time. I can change my specialty whenever I want in UK if I don't like it.
So Plab is a more freedom, like that platform gives you more freedom to choose whatever you want in the future.
You're right, Abhijit. So Plab actually helps you to pursue your passion is what I feel. Because if I am passionate about surgery now, I will do surgery. If after some years I get bored with surgery, I don't like surgery, there should be a pathway that I can actually shift to medicine or radiology or OBGYN, something like that, right?
So how am I supposed to go with it? Like I am currently a final year MBBS student of GMC Nagpur. That is if I pass in this exam. What next? What should I do next? What should I read? Which exam should I give? There are a lot of questions that I want you to answer.
Yes. So Abhijit, firstly, I know that definitely you are going to pass. I'm just waiting that you'll message me. I got a gold medal again. 3 straight. So 3rd in the line. So I know that, okay. So for a final year, so these are some things that I'll now tell about the pathway more than what I perceived, okay. So pathway Plab is Professional Linguistic Assessment Board. Plab, in simple words, is a licensed exam to gain entry into the UK. Okay, it doesn't guarantee your residency, but during this pathway, you develop your CV, that is curriculum vitae, that how you are. There are multiple sectors to your CV now. Once you are in the Plab pathway, and during this journey, you can actually work on them, and you can then apply for residency, which hope so I'll be applying in this October. Okay, so before going for Plabs, there's a one English exam that is called as OET, Occupational English Test. Okay, or there's another exam that is IELTS. So I don't know the full form of it. Okay,
basically there is like after going into final year, am I supposed to give OET and IELTS?
Yes. So this is a very valid point. Many people don't know about it, that once you pass your final exam, not before it. Okay, Abhijit.
Okay.
Once you pass your final exam, you are eligible to give the English exam as well as your Plab 1. Okay.
Is it before internship or after internship?
Yes. So once you pass your final year, it means that you will be entering the internship. So it's not necessary to complete the internship to give Plabs. What people have misconceptions. Okay. So I'm considering Abhijit as the ideal student. Okay, who is pursuing for Plab. I will tell him, and you can relate to it. Okay.
That will be great.
Right. And before this as well, and then I will tell you what the students in another years, like second year, first year, minor, can work towards, pursuing your future in NHS, that is Plab, and this GMC. Okay. So once you pass your final year, you get your passing certificate, you are passed. Okay. You can actually start the internship, right? So you can book for the English exam. Okay. There are multiple slots. OET happens twice a month. Okay. Whole throughout the year it happens twice a month. IELTS happens as well, like twice a month.
Which one should I prefer, OET or IELTS?
So you are asking me very deep questions now, Abhijit, because there is always a debate and controversy, like what you can prefer. There are multiple points. I'll try to say that, and maybe we can decide on their own. Like people can decide on their own what they want actually. Okay. So OET is more of a medical oriented exam. So there will be 4 sections in any English exam, that is reading, listening, speaking and writing. Okay. You have to get a sufficient grade in that. For example, in OET, you have to get a grade B. Below that, you are not eligible for booking Plab 1. You have to get at least a grade B or grade A if you are super smart. I'm not. Okay. And in IELTS, you have to get average 7.5 banding with lowest 7 in each section. Okay. So this is the criteria for the English exam. Okay.
Okay. I'll ask a simple question. Which one of them is easier?
Personally, I gave OET, and I feel that OET is a simpler exam.
Okay.
Because
OET it is for me. Then I no questions asked.
Yeah, because you have been reading medicine, Abhijit, for 3 years now, right? If I ask you something related to medicine, you will be able to answer it easily, right?
Yes.
If I ask you what are the mountains in Himalayas and something like that,
I am very bad at geography.
Yeah, so it becomes little difficult to get oriented to it. That is the thing. So I feel OET is little bit costlier. Okay, I will talk about the expense at when Abhijit asked me.
Okay.
But apart from the cost, OET is a simpler exam.
Okay, let's say final year is done. I got my passing certificate. I am done with OET. Now what next? Should I go into internship or like what are other things?
Yeah. So Abhijit, very important thing. So in general, UK and the NHS, that is National Health Service, they always want you to be working. Okay. They don't want you to sit at your home for 1 year preparing for an exam. They don't want it. They want you are a doctor. Okay. First of all, don't forget that you're a doctor now. Okay. I'll address all of you as doctors now. Okay. You are a doctor, so you should be working all the time. Okay. So it's not that you have to leave internship or you don't have to start internship. Okay, Abhijit?
Okay.
So you are doing internship, right? You are doing internship now. You are giving one final exam. You went to OET. You gave the exam. After 3 weeks, generally you get the results. Okay. Abhijit has cleared OET now. Okay.
Cleared.
Yes. Then you have to, next step, you have to make an account on GMC. Okay. GMC is General Medical Council. It is not government medical college, what Abhijit studies in.
Okay.
General Medical Council is the medical council, like we have National Medical Council in India. It is GMC in UK. Okay.
It's just something that we can Google and get an account on, right?
Yes. Yeah. GMC online, you can make an account. You have to fill in basic details and all this. Firstly, disclaimer is it's always better to have a passport with you all the time. It's not necessary for OET, but I will prefer that. Anyways, you are going to be in UK, right? You will need a passport now or then. So it's always preferable to get a passport done. So you gave your OET, you made a GMC online account. Next step is you have to book your seat for Plab 1. Okay. So I'll tell you what is Plab 1 first.
Yes.
Okay. So Plab 1 is a MCQ exam. It's a 180 question, 3-hour exam with 1 mark for every right answer, and there's no negative marking. Frankly, Plab 1 is at the level of an undergraduate level.
So is it easier than NEET or is it harder than NEET?
So frankly, I've given both NEET and Plab. I can say that Plab 1 is easy exam as compared to NEET, because there are a lot of questions that NEET asks which are not even taught in our med school. In Plab, it is just what a basic doctor who is cleared as MBBS should be able to do when he is asked to provide a service. Okay, basic emergencies, all these things should be like that are the things that are asked in Plab 1, and it has nothing to do with super, what you can say, very high level of biochemistry or something like that. It doesn't ask you that.
First question is, how many times do these Plab exams happen throughout the year?
So yeah, Plab 1, it happens 4 times a year, Abhijit. I know you will be shocked, but it happens 4 times a year. And not only in India, it happens all over the world 4 times a year. You can actually book the exam in India as well as abroad, wherever you want to. And getting a visa becomes little easy because you have an exam you have to give. You can book in UK as well, just get a vacation and go to UK, give your Plab 1.
I'm definitely not going to give an exam in my vacation, so maybe afterwards.
Yeah, definitely. So Plab 1 happens 4 times a year, as I told you. It happens in all the metro cities, the centers. So Mumbai, Chennai, then Coimbatore, then Hyderabad, New Delhi, Kolkata, everywhere Plab happens, Plab 1. You can get there. It's 1 3-hour exam. You can book the exam and then you can go for the exam date, okay?
As every exam needs material, what am I supposed to read for this Plab 1?
Yes. So first I'll tell you what are the basic syllabus for Plab 1, right? So Plab 1 mostly tests your clinical knowledge, right? So the subjects that are after your 3rd minor, for example, medicine, surgery, OBGY, then dermatology, little bit of radiology, basics of anatomy, ENT, that is ear, nose, throat, and ophthalmology.
Is there community medicine?
No, there's no community medicine. But don't be happy, Abhijit, okay? There is some part of what you can say epidemiology that you have to go for some basic equations in biostatistics.
I am going to skip some questions in Plab.
So you actually you touched the very important topic, that what is a passing rate, right?
Yes.
Passing rate. So it is a 180 question exam. Generally, okay, nowadays I'm just comparing the passing rates nowadays. So it generally 120, okay. So, I didn't address the most important thing. Plab 1 is a pass or fail exam.
So there is no ranking?
No, there is no ranking. Even if you score if the passing score is 120, if you score 120, you are pass. Even if you score 180 out of 180, you still are pass.
So basically I just have to go there, get 120 questions correct, come back and I'm done.
Yes, it's really simple as that. Obviously you have to study for it, but it's just that you don't have to get ranks in Plab, because as I told you, it's a licensed exam. You can't be ranked on that. As you were asking about the material, right? So material, for Plab 1, generally you have to know the basics of every subject what I told you, right? You don't have to know what complex management in medicine or surgery, the basics, right? Basic trauma or something. Regarding material, so I can actually, this is the best time actually we are talking about it. So I just launched my Plab 1 notes, that is, you can see there, this is the handwritten Plab 1 notes. When I was preparing for Plab 1, I realized the scarcity of the material in this pathway. The scarcity of information was another thing, that's why we are shooting this video. But for scarcity of material, I think so you got covered. You have these notes, okay?
I'll keep the link in the description, don't worry.
Yeah, so you have these notes, okay? And there's a lot of Q banks available. I cannot name specifically, but there are examples such as Plabable.
He actually volunteered in making questions in Plabable.
Yes, I told you I was a volunteer there. So I help actually people making these questions in Plabable as well. So Plabable Med revisions, UK Med, there are a lot of Q banks available, and frankly, more or less everybody is the same. You have to know the approach to Plab 1 is what I know. I know you all are doctors and you're super intelligent like Abhijit. I'm not, okay. So you just have to know the basics, okay. You have to know the basics of every field, not very high core exam, and then you have to know the approach. What happens if you read the notes, you know the basics, okay. So I got you covered in the basics. And while attempting questions, it helps you to know how to approach to the questions. Generally, NEET has also started giving a lot of clinical questions these days. Am I right?
Yes, yes. So Plab is about clinical questions,
Exactly.
not MCQ type facts.
No. You will not get a single factual question in Plab 1. The question.
We are sitting in the OPD and the patient is coming to us and treatment.
Perfect. Okay. So Abhijit just stole my words. Okay. So frankly, when I used to approach Plab 1 questions, I used to feel I am sitting in OPD. A patient has come with some this difficulty, this shortness of breath, blah blah blah, and the question asks, okay, what will you do next, or what will be the investigation you'll be ordering, or what is the investigation of choice. Generally, it's not very factual. It's just the very common things that we learn during our medical school as well.
So I'll say after final year, if I do internship diligently, I'll be good to go with Plab 1, right?
Definitely. See, if you have passed final year and you got the passing certificate, right? It means you are medically sufficient to go for Plab 1. You don't need loads of books, loads of MCQs, loads of knowledge in that. You just need basic things, and which you have already been taught, right? If you have passed your final year, it means that you know the basics of medicine. That is what is being tested in Plab 1.
Okay, and that's all about Plab 1.
Yeah, that's all about Plab 1.
So Plab 1 is done, and I'm hoping that my internship will be done by the same time, right?
Yeah, so as you book whatever the date you feel comfortable, 4 times a year, right? It happens. Right. Whatever time you feel comfortable, you can attempt the exam. In 1 year, you will be done with the internship. Okay. As you are done with the internship, I will suggest to do one single thing that is important in this journey is epic verification. Do you know what it is?
What is this epic?
Epic verification. In simple words, epic is by the ECFMG. It's one of the body in US that actually verifies your degree, whether it's legitimate or not. Okay, that you once you are done with internship, I'm hoping that you will get a degree in your hand.
Okay, right.
Right, you get a degree. Then you have to approach to the epic people. Okay, there are some basic fees of verifying your degree, and
this am I supposed to do it?
Online. Everything is online. Everything is online, and you don't have to go anywhere. Just sit at home and just Google what is epic, and there are lots of resources actually which you can access any Plab knowledge. Okay, I'll tell you.
EPIC, right?
EPIC, or the body is ECFMG. Okay.
ECFMG.
Yeah, epic verification is done. Okay, so you have to verify your degree. There are some steps which will be guided when you Google about it. Okay, you'll need a passport and your degree during this time. That's it. Okay.
So I need to make my passport in internship itself.
Yeah, it's always preferred, I told you. So you can give OAT without passport as well. But I will prefer you to, because once you are a student, right, Abhijit, it's even easy to get the passport. Okay. Because you have a college to your name. So it becomes easy, the police verification and everything goes very easily.
I have a very big question is, final year done, OAT given, internship done, Plab 1 done. Is there any expiry date to any of these exams?
Yes, very valid question, Abhijit. So OAT or IELTS, any English proficiency exams has an expiry date of 2 years. Okay. What does expiry means? It means that you have to get your GMC registration. That is the final step in this pathway before that time. Like once you give, today you give OAT, within 2 years, you should be giving your application for the GMC registration. In short, you will be passing your Plab 1, you will be passing your Plab 2, and you have to apply for GMC.
So basically, if I give OAT in this year, I have a 2-year gap to finish Plab 2.
Yeah, you have a 2-year window actually, I can say. Yes. Yeah, to give Plab 1, Plab 2, and you apply for GMC registration.
So the time starts ticking that the moment you give OAT.
On the day of your results actually.
Okay, on the day of my results.
Okay. Yeah. So I'm considering that you are doing internship, and in internship only you have given your Plab 1. You got your Plab 1 results. Okay. You have passed. Congratulations, Abhijit. Okay. And then you are done with your internship, and generally what I can say is people have some bonds, that is compulsory bonds that needs to be done.
There is MOship of 1 year.
Yes. So what happens is, if you don't get even a seat in Plab 1 in your internship, you are still working, right? I'm considering that Abhijit has joined as a medical officer somewhere. Okay. He has joined there somewhere, and he can give an exam during that time. He will be earning. Okay. One big advantage apart from earning is that he will be working, and actually that matters. So clinical gap is not a good thing as far as the Plab journey is considered.
So if you want to give Plab, you need to keep working as a doctor because it
So yeah, Abhijit, that's a very valid question. It is not a mandatory thing, but what I can say is preferred thing. Okay, it's not that you will be rejected your application if you don't work, but it will be good if you are working and then you are giving your plabs. Okay, you do not need to sit home for 8 months preparing for an exam. You can you can like study for 3-4 hours daily. That is sufficient for plab 1.
Okay, so in the end of final year, I give OAT1. At the end of internship, I give Plab 1, and after 1 year, I give MOship of 1 year.
Yeah.
So Plab 2 will be like after 2 years, na? So OAT will be terminated by that time.
No, so this is a very valid question, Abhijit. So you are done with your internship, you have done with Plab 1, okay? So once you are done with Plab 1, you can actually book for Plab 2. And Abhijit, don't be shocked. Plab 2 happens 5 days a week throughout the year. Okay.
So it's basically like exam is every day.
Exam is every day apart from Saturday, Sunday, because you have to balance personal life.
Right. Plab is all about that.
Yeah. So it happens throughout the year and it happens 5 days a week, as I told you, apart from the December thing. But yeah, getting a seat has become difficult these days, but not impossible. You can imagine if the exam is happening 5 days a week, okay, you can land up a seat with the whatever time frame you are going through, and you will definitely get a seat.
So basically, I can actually plan a vacation to UK and get my exams done.
Exactly. That is what I can say, that you can when you go for Plab 2. Okay. So yeah, Abhijit will first answer the question, where does Plab 2 happen?
Right.
Okay.
Where is it?
So Plab 2 happens only, okay, till now in Manchester, United Kingdom. The same with Manchester United football team. Yes, Manchester City fan, sorry. I'm Manchester United fan, okay. So it happens in Manchester, GMC building, that is 3 Hardman Street. I'm also telling you the address of the building. You can like put it on Google Map and just know the distance. And so for that you have to apply for a visa. Okay, there are many visa sites which Abhijit will be putting in description.
Definitely.
Which you can get help from for Plab journey. So you are going on a standard visitor visa and your exam booking of Plab 2 helps you to get the visa as well. So no hassle in that.
How much time does it take for the visa and stuff?
Officially it takes within 15 working days. That's it. Not more than that.
So if I want to plan for Plab 2, I mean, if I'm done with Plab 1 by the end of internship and I'm now doing MOship or something, during that I get some holidays of 10-15 days, I can plan for Plab 2 1 month before and just give it.
Yes. So Abhijit, it all depends on how you prepare for Plab 2. Okay. We didn't tell our viewers what is Plab 2. Okay. I'm sorry. So Plab 2 is an OSCE exam. OSCE means it is a clinic.
It's not MCQ exam.
No. Done with you are done with your medical knowledge. Plab 1 test your medical knowledge. Plab 2 test how you apply your medical knowledge. Okay. So it is OSCE exam, that is a clinical exam. Okay. There are, for example, at present there are 16 stations. For example, there are stations singly, that is ethical stations, some medical management stations, some surgical stations.
What are these stations?
Yeah, so they are nothing less than a cases. What I can say simply is maybe your final year viva.
Okay.
Okay, so final year viva, wherein there is a patient. Apart from Plab 2, there is a role player. It's not actual patient even. There is a patient and there will be an examiner, and you will have to talk to the patient, get the history, tell him what is the expected management, and it is okay to not know the management. I didn't knew management to some stations in Plab 2. I still passed because.
What is the pass-fail criteria?
Yeah, so if the exam is of 16 stations, you have to pass not more than actually 9 stations.
Okay, so I need to go through 9 stations and pass it.
No, so you have to go through all the 16 stations.
Okay.
And it is okay if you even pass through 9 or 10 stations.
Okay.
Okay.
And who tests me? Like, do the patients which are actually not patients, they are the drama persons, do they test me, or is there a teacher? Yeah,
so there is an examiner, okay, who is sitting somewhere in the room, okay, and you are being recorded, Abhijit, as well. So there are examiners who are actually watching the recording all the time, how you talk to the patient, what is your body language, how you console the patient, how you ease out the patient, all these things. And there are people who are watching the video who will give a score. The examiner sitting in the room will give a score, and that will form a score that will actually help you to pass that station.
So it actually checks our doctor-patient relationship.
It actually checks how good doctor you are, how you talk to the patient, whether you address the patient concerns or not. Okay. Apart from that, Plab 2 is as I told you about the stations. It is the station counts for 8 minutes. One station 8 minutes. So approximately I can say it is a 3 to 3.5 hour exam. And after that, yep, you are done with Plab 2. Okay.
Okay. You told me that there are Plab 1 resources that are your notes. Do you make any notes for Plab 2? I mean, how am I supposed to prepare for Plab 2?
Okay. So this is a very good question. So Plab 2, actually it's very important to prepare for Plab 2 because we are not taught the way as a doctor-patient relationship moves, right?
Okay.
So there are many discrepancies. We are not even told how to talk to the patient. We talk to the patient, but we are not told how to talk to the patient. What is the importance of communication skills? How you can ease out the patient like that. So for Plab 2, Plab 2 is more important is how you perform in the station, right? So once you go in the station, you have to go for mocks, is what I can say. So for example, me and Abhijit is preparing for exam. What I can help Abhijit is that I will be the patient and Abhijit will be the doctor in that, and we can have mocks. So regarding resources, there are few academies that are very famous nowadays. Abhijit can give in the description box what are the common academics actually.
Okay.
Yeah. So there are academies which help you to go for a 15-day course, and you are taught in that 15-day course the stations, what are the common stations and like that. And Abhijit, one more thing is I am actually planning to start a mock stations. Okay. So there are many people in the Plab 2 journey who once they pass, they start taking mocks. So I am also planning, I have some Telegram group as well.
Please send me the link and I'll just
yes, definitely. So I actually take mocks for Plab 2 as well. And that is really helpful. What I can feel is, because you know the medical knowledge, right? Yes. You have passed Plab 1. It depends on how you apply it. And for that, you need someone who actually tells you where you are going wrong, right?
Right.
As a doctor, you are perfect. But as a doctor-patient relationship, you have to be perfect, right? That is the basis of Plab 2.
So we need to be empathetic towards the patients, and we need to show it to the patient.
Exactly. You have to be very gentle. As you told me, you have to be very empathetic, and you have to be a doctor. It's not like asking you to be construction manager or artist.
Right.
It's just asking you to be a doctor, which you already are.
Right. Okay, so I'm done with OAT. Final year OAT internship, Plab 1, MOship, Plab 2.
Okay.
Now do I get the college, or what's the next step?
Yes. So Plab 2 results generally come within a month. That's it. It doesn't take months actually. It just takes within 3 weeks. Okay. You are done with that. Now you are eligible to apply for the GMC registration. Okay. GMC registration is nothing but the license to practice in the UK. Okay.
I need to do all this. I have to do Plab in Manchester.
Yeah.
So am I supposed to come back afterwards, or should I stay there?
So Abhijit, there are 2 answers to your question. Immediately after the day of your exam, you can come back. Okay, it doesn't matter. But there are many people, including me, who actually did some clinical attachments. So you can actually come back after giving your exam the very next day even. Okay, or you can stay for any clinical attachments, if any. Okay. And when you're done with that, you have applied for GMC. GMC asks you for certain documents, including the English proficiency exam.
We are supposed to give it in London or online?
Online. Everything is online. Yeah. Due to COVID, until now, everything is online. You have to just send an email with all your documents merged. Your degree, your OET results, your Plab 2 passing, everything. I will enlist it about later. So you are done with it. Maybe GMC will take a week or 2 to give you the results. Okay. And you get the GMC registration.
So now I can practice as a doctor in UK.
Yes. So I missed your question that will you get a college or not? Okay.
Exactly.
Yeah. So college system doesn't work in the UK. Okay.
So it's not like this we have in India, there is NEET PG exam, we get rank, we select college. It's not like that.
No. So what it's like that, see, once you get the GMC registration, you are eligible to work in the UK. Okay. And then you can apply for residency, and there is a system of earning while you learn. So you are a doctor now. Okay. You are no longer a student. So, okay. Maybe the most important thing which Abhijit will actually be angry on, there is no tuition fees in the journey. Okay. So there is nothing called as fees in UK, because you will be paid as a doctor. Not as a student, you have to pay the fees. There is no tuition fees.
So you go to the hospital and you get paid for working there.
You will be paid as a proper salary.
Even as a student.
You are no longer a student.
Okay.
You are a professional now. I know that the systems in India make you feel like a student even after 8 years after your graduation. In MCS, you are still a student. This not the system is like that. You are a doctor. You will be paid very handsomely. The salary is not a stipend. You will be paid a good salary. Okay. And you get a salary there, and there is no tuition fees because you are providing your valuable service to the system, right?
Right. So after Plab 2, I can work there as a doctor.
Yes.
But where does this, like, if I want to be a surgeon, how am I supposed to get into hospital and
Yes.
residency?
Yes, so very valid question, Abhijit, because I also am answering that question. I can relate to it. For example, if I want to be a surgeon. So at this time, I have cleared my Plab 2, I've got my GMC, I've got my first job.
Okay.
So first job, I will do this job for few months in order to know the system well, okay? I don't want to rush in, okay? If I want to do surgery, I have to love surgery by heart, okay? So I will work in trauma and orthopedics for a few months, and in maybe October this year, I will apply for the core surgical training, which is nothing but the residency program.
Is there any exam for that?
No, there is no exam for that. You are done with the exams, Abhijit. No exams now.
So how am I supposed to apply?
Yeah. So obviously you will have a UK license.
Yep.
Yeah. Secondly, you have to build your CV.
What is this CV?
Yeah. So CV is generally, we are not very taught about CV. Maybe the IT professionals know what is CV, right? So CV is nothing but your professional records. Clinical, what I can say in simple words, 4 things. Clinical, where have you worked? Academic, what exams have you qualified? What is your registration? Blah, blah, blah. Management, do you owe any leadership skills?
Do you YouTube channel?
Yeah. So Abhijit, you can actually put up this YouTube channel in your CV that I have this thousands of followers, lakhs of followers who watch my videos, and I educate them regarding Plab. You are a leader of this group then.
Okay.
So you get points over this as well. Okay. And then next is personal, like what hobbies you have and all these things. All these things matters because you want to be an overall doctor. You don't have to be just the academics doctor, right?
And they value you as a person.
Yes. People look up to doctors. I have been there for a few months. I realized that people value the doctors there so much. They feel that these are like a whole round person that they always want to be, right? So research is also one of the very core part of CV, audits.
I have already put a video on research. So
Do check.
it.
Yeah, do check somewhere in this box.
Right.
Yeah. So research is also one of the very important things. As Abhijit has done a video on it, you can relate to it.
Yes.
This is actually forms the part of the CVs.
Okay. So is your working in UK also part of CV?
Exactly. I will be working in King's, which is one of the very good trust, I can say, very prestigious. So the way I work in the King's also is reflected in my CV, because my consultant will write something about me that he has worked very good, bad, anything.
Okay.
And during that time, I can actually work on my CV. I can get involved in the research. I was talking to Abhijit that I'm doing a research.
Right, about the meta-analysis.
Yeah. I'm doing a meta-analysis of reviewing some 600 papers now. So all these things matters when you're applying for CST.
So after Plab 2, if you stay in UK, you get a job, a salary, learning experience, and a good CV. Like it's a plus everywhere.
Yeah. So, when you work on research, right, it helps you to grow, right?
Right.
It helps you to get to more things, and that is the reason that there are multiple things that are being counted when you apply for the core surgical training.
Okay. So let's say I'm done with Plab 2. I put an interview, I get a good CV somehow by miracles of God, and then I get selected in the college. Let's talk about colleges first. Like, what are the options?
Yeah. So I will again correct you. There is no college. Okay. There are hospitals. You will be working there and you will be parallelly training there. Okay. So you are not being taught. So there are obviously academics in that hospital, but you will not be behaved as a student.
Yes.
You will be a professional who is learning. Okay. So for example, core surgical training is for 2 years.
Okay.
And after that, you have to, such as we have exam in a PG, that is final year PG, like third year PG students give that. We have there at the end, there is exam called as MRCS, that is Member of Royal College of Surgeons.
So basically, after Plab 2, I applied to a hospital, work as a doctor for 2 years in a core surgical team. After 2 years, I select some branch that I want to be in, and then I give an end exam called MRCS.
Yeah, Bijay. So at the end of the core surgical training, you give an exam called as MRCS.
Okay.
You are a member of the prestigious Royal College of Surgeons now. Okay. And after that, you can apply for the specialty you like. For example, Abhijit likes orthopedics, or he likes plastic surgery or urology. He can apply as a there for registrar level that we call as senior resident. We can say that. Okay. As this very common question that how much time after Plab 2 you enter the core surgical training. That's it, 2 years in core surgical training.
Fine. So can you explain me the whole timeline after Plab 2?
Yeah, so you are getting a job, you have applied for the CST, you have an interview there which scores you on the interview as well as your CV, and then you get into core surgical training. Okay. 2 years of core surgical training, rotations in multiple departments in surgery, 6 months, very beautiful rotations, and it's all regulated, right? So you don't have to rush into it. Okay. Until you do this basic procedures, they won't even let you go ahead. They will definitely make sure that you get these basic procedures as a doctor. As an orthopedician, you should do some hip replacement or blah blah blah. Then only they promote you to the next level.
Okay, and what's this next level?
Yeah, so 2 years in core surgical training, you are giving MRCS, that is Member of Royal College of Surgeons, which is a prestigious institute. You are done with it, okay, and then you can apply for the ST3 position. So now the big question, how much time in each specialty?
Right.
So residency, what you can say in UK depends on the specialty, okay. Some specialties are shorter. For example, GP is shorter, that is 3 years.
That is general practitioner, right?
Yeah, so it's a very nice job in UK. Trust me, it's a very nice job as well. For example, some are very long specialties, that is neurosurgery, for example. It is for 8 years.
Okay.
But 8 years is after your CST is included, because neurosurgery is a run-through program. So after you get your job and you apply for core surgical training, there is another training, that is run-through training. When you apply for run-through, get selected, you do a 8-year neurosurgery.
And it goes parallelly with that 2-year thing?
No. So if you go into run-through, you do not need to enter CST.
Okay.
You can directly go to run-through program.
Okay. And you mentioned something called ST3. What is that?
Yeah. So ST3 is nothing but the JR3 at that level.
Okay.
So 2 years of core surgical training, then you enter some specialty. For example, ortho or plastic or general surgery, colorectal surgery, wherein it depends on the duration of it. For example, general surgery is 6 years. Plastics is 6 years.
6 years including those 2 years?
Yes, 6 years including those 2 years. Like 2 plus 4, it's like that.
Okay, so if I am to start from this year, like 2022, I'll be a surgeon at 2028 if I clear Plab 2 in 2022.
Yes.
Okay.
Yeah. And Abhijit, I know people think that, oh, we have just 3 years of residency and we are a surgeon, right? But those 6 years, you won't be merely a specialist. You'll be a super specialist. Like when you clear this 6 years of training, right? And you give the exam, that is course completion test, that is CCT, you are actually recognized as a super specialist in the India then. Okay. And okay, it is recognized in India. There is a proper guideline by the National Medical Council that CCT is recognized in India as a super specialty degree.
So we are like going by the timeline. Currently, I am done with being a super specialist surgeon in UK. Bhai, paisa kitna lagega? Like all these years, how much am I going to spend? Like how much am I supposed to ask my parents?
Okay, so I will address this big question. Okay, Abhijit, you were beautifully telling about the timeline. When you land your first job, as we have discussed, right? From that time, you do not need any money. Okay, you'll be getting money. Okay, practically, you'll be paid well. Apart from that, the exams, the courses you do once you are working there, there is a separate fund by the trust that helps you sponsor all your exams.
So the trust will pay for me.
Exactly.
Cool.
The trust will pay. There is a study budget for every trainee there.
Okay.
It's almost 70,000-80,000 rupees in our value every year. Okay.
Okay.
So it is there. So before the job only we will talk about expenses. Once you land your first job, man, you're earning lakhs of rupees per month. You don't need not to ask your parents for money, or I'll say Abhijit will call their parents, how much money you want, tell me.
So basically from final year OAT to Plab 2, that's the only part when I'll have to ask for money.
Yeah. And Abhijit, you have mentioned that you will be working as a medical officer, right?
Right.
You will be earning as well.
Right.
I'm considering that.
Yes.
You'll be earning well during that time, right?
Hopefully, yes.
So I'll tell you the expenses. I'll crudely tell about the expenses at this moment. Somebody will watch these videos after maybe months or years.
It may differ at that time.
Yeah, and I'm telling you this conversion by Indian rupees. Some exams you have to book in pounds, that is the currency in UK. So IELTS is around 17,000 now,
Okay.
Indian rupees. OET, that is occupational English test, is around 36,000
Okay.
currently when I gave exam. Plab 1 counts for 24,000. Okay. Plab 2 is costly exam. It's around 89 to 90,000 rupees.
Okay, 90,000.
Yeah. GMC registration, which you have to do after you give your Plab 2, you pass there, it's around 16,000.
Okay.
Epic verification, it counts around 18 to 20,000.
And along with the airplane tickets, what is the total?
Yeah. So I've maybe detailed description of the cost. Now I'll crudely tell you for whole the Plab journey if you go for it in the first attempt. Okay. Because if you give more attempts, the cost will rise.
Of course.
I'm ideally considering as Abhijit will do it in first attempt, I know.
Fingers crossed.
So you can say that 5 to 6 lakhs.
Okay, 5 to 6 lakhs to become a doctor and land a job in UK.
Yes. Considering you are doing everything in the first attempt, which many people will do, our viewers will definitely do it. I know that. They are smart people, right?
Hopefully.
Yeah. And maybe if you are considering living in UK for another month during your Plab 2, you can say the expenses can stretch to 6 to 7 lakhs.
Okay, but not more than like 6-7 lakhs.
No. And consider your earning as well.
Right.
Every month you are getting a salary.
So you guys, you better subscribe to get me to Plab.
Yeah. Please subscribe to his channel. He's one of the most dedicated person I ever see.
Thank you very much.
And so telling about the expenses, I did work as a medical officer, I told you, right?
Yes.
I worked for almost 11 months. I covered all the exam fees. Only I asked for money from my parents when I went to UK because I stayed there for 2 months.
Okay.
Just the cost of my expenses in UK were borne by my parents. Apart from that, I did pay for all of the exams. Also, I did MRCS Part A as well, which maybe we can have another video or maybe another session.
Right. I need to ask about how you did MRCS even before becoming a surgeon.
Yeah. So big misconception which this video Abhijit will be shattering today. And I had this lack of information before giving the exam. You do not need a MS or what you can say super specialty degree to even give MRCS Part A.
When can I give MRCS again?
Once you are a medical graduate, right? After your internship, you get your degree. You can next day book for your MRCS Part A.
Wow. So after MBBS, I can be an MRCS
Part A.
Part A.
Yeah.
So MRCS Part A.
Yeah, and you can actually give MRCS Part B as well. But MRCS Part B requires clinical experience.
Okay.
That you have to work for some time, maybe an year or two.
Okay.
Then you can go for Part B. But practically, the next day in your internship, you can get clear with MRCS Part A and Part B legally.
So there are some changes in timeline. Final year, OAT, internship, Plab 1, MRCS Part A, and then Plab 2.
Yeah, this is for me, okay? Because I was at home, COVID, thanks to COVID, I didn't have anything to do. So I thought maybe I'll give MRCS Part A. I gave that. So the reason I'm just telling you is that you can also give that. For people who want to do medicine, they can do MRCP.
Okay, MRCP.
For example, you have to do MRCOG. I have some friends who gave MRCOG. For people who want to do emergency medicine, they will give MRCEM.
Okay.
There are a lot of exams which helps you to add what you can say feather to your cap.
Okay.
It's plus point in your CV.
That's good. Okay, so all of it is done. Like you're going to be a surgeon sooner than me. What is your perspective on? Like, should we wait? Like, should we stay in UK or should the doctors come back? Like, what's going on currently?
Yeah, so this is a valid question, and Abhijit, let me tell you, whatever I've said in videos we have discussed is response to what my personal experience and my personal opinion is that people may differ with their opinions. Somebody will call this a very bad pathway. I'm okay with it. Because might be they didn't have good experience. I had good experience.
People will keep on judging.
Yeah, people will still think why Abhijit is not studying and is doing these videos, but ignore that. So always know the facts, watch videos like Abhijit's, get everything sorted, and then decide for yourself. Do not decide on the basis because my senior didn't tell me to do it, that's why I'm not doing it.
Exactly.
I had no senior telling me why to do Plab and why not to do anything. So it's not necessary to have someone always backing you. You have to this decision, and this guy is doing this. He doesn't have any senior who is telling him to shoot YouTube videos. He's still doing it. So there is no one.
Thank you very much.
There will be no one always saying, no, do this, do that. You have to decide on your own. Okay. Regarding this question about staying, so it all depends on how you like the situation. Okay. I will be started working. I didn't work for very long in UK now. Okay. I'll be working. I will enter the residency. I will be doing my post graduation for sure in UK. I'll be entering the residency there. Hope so. Okay. And then I will decide for the future that whether I have to come back or not.
The main concern is that like parents think, see, India has a universality of marriage.
Yeah.
So if we settle in UK, parents think that we'll just go and marry there and then settle for life and we won't be coming back.
Yeah. So addressing that question, I told you already, if you go for the CCT, like you complete your training in there, the CCT is recognized in India as a super specialty degree. Consider you are worked in UK for 8 years, you have a super specialty degree to your name, and who is going to stop you from working in India? Tell me.
You can just come back, set up a hospital and
Obviously,
get a boom.
yes, you can. If you know how to treat patients, the world is your place, right? The world is your OPD, I can say that.
Right, that's a very good line.
Yeah, so you can work anywhere you wish to. It all depends. So if there are people who think, no, I have to go and settle down abroad, they can go there, they can live their life, they will get paid, everything. But some people, as Abhijit told, parents are worrying and some have to look after their parents. So what we can do is that we get the training in UK for whatever years, depends on your specialty. Some specialties end sooner, like 5 years, 6 years. We can come back, maybe we can start working in any corporate hospital as well. I have myself known many people in this era who have been in UK for 10 years, who have came back, who are doing exceptionally well in Nagpur only.
Right, because you get a tag of London.
Exactly. Your branding, if you are saying as a doctor, I know that many people will think, yeah, this is business minded, but trust me, you have to think about all these things. You are an adult now, you have to think what you are going to do in life. When you go out, you indirectly starts your branding actually. So 8 years in UK, people will start saying, oh, he was in UK, he must be a good doctor.
Right.
This is the general perception. You consider Abhijit is from Verda properly. Consider Abhijit is in UK for 8 years. Abhijit is working in some very big shot hospital here, or he has started his hospital. He's going for one day as a, what you can say, visit OPD in Verda. Can you think how many patients will be lining up after his outside his OPD?
And the only reason being that London in my name.
Yeah. And first, frankly, Abhijit, let me tell you, not only the name, you are very beautifully trained there as well. Okay. So when you are giving much years in the training, it also reflects in your work.
So the skills you get there are a bit sharper than that in India.
You can say that in many aspects. So I'm not saying that people in India and anywhere are no less or not. I personally love the healthcare system in India. Frankly, I do. Okay. People may differ from me, but I love the healthcare system. It is very accessible. Anybody can access any doctors in India, which is really a miracle actually. But there are, what I can say, everything has their own pros and cons. I feel the skill set you acquire once you work in very good environment with a good work-life balance, I think so I'll get it better in the UK. That's why I may go for there.
Now we have talked all of the good things about UK.
Yeah.
Like for me and for these viewers, tell me some of the bad things.
Okay, so bad things also, it's my perspective. Okay, I saw that elective things in UK takes a lot of time. The healthcare is not very accessible as in India, because you have to go to a GP and he will decide where you have to be referred.
Can you give me an example? I'm not.
For example, what we do is, I don't know whether it's right or wrong, but if you have some headache or something, what you generally do, you go to a MD medicine or something,
definitely.
or if you are like super intelligent, you go to like DM neuro. You are having a headache. In UK, it doesn't happen like that. You have to go to a GP, tell him ki I have some headache. He will give you some medications for a few days, and if it doesn't go well, he will again ask you to take another medications and all. And if he feels important that no, you need to have been seen by a specialist, then he will refer you to a specialist.
So you directly cannot access higher doctors there?
No, if it's an emergency, you get the treatment very next minute.
Okay.
Next minute, you are in some, what I can say, emergency, you go to the hospital, you get a team where the specialist, even the consultant sees you in the first instance. It's not like that.
So if it is an elective surgery like cataract, it's going to take time in UK, but on the other hand, in India, it's going to be done super fast.
In short, you can say that. In cataract is elective surgery, so it takes time. As I told you, the work-life balance is very seriously looked after.
Right. So doctors have a much better life there, we can say.
Yeah. Regarding your parents, so generally, if your parents have to accompany you to the UK, they can't actually be dependent on you totally. So you can go for a visa for 6 months to 2 years.
Okay.
After that, you have to redo the visa thing.
Okay.
If you are saying that. Also, you as a doctor, also if you are working in the UK, if you and your maybe your family is working in the UK, they get complete healthcare. So I am again telling advantage, not a disadvantage, but you get everything free.
Let me ask a few straight questions that might hurt a few of the viewers, but I need to. Is there any racism in UK?
At my level, I didn't notice any.
Is there any girl-boy differentiation in UK, which might be prevalent in India? I am not saying anything about it. I did not say it.
What's a girl boy in UK? There's nothing called as that.
Okay, so all of us get equal treatment.
Obviously, everything gets an equal share. Everything has an equal opportunity. If you're, in simple words, if you're good in something, you get a very good shot in UK.
Do they pull our legs if we are going too far or something?
I have been supported by people who are not Indians, okay? I have known these people for not more than 3 months. There are people from Poland who is a Poland neurosurgeon who has helped me immensely in my first attachment. Another, he's a Canadian orthopedician. He has helped me. I'm doing a research with him. There's another consultant in Kings. There are a lot of people who are not Indian as well. They've helped me immensely. The only reason is that I was working hard for that, and they actually pick you up. If you work hard, they actually pick you up. That he's working hard, will not let him go.
So as long as you are dedicated to your work, you keep on going up.
Yeah, and I like to address that question about racism is that at my level, I'm very naive in answering these questions, I feel. Maybe, okay, there is politics everywhere in the world. There will be politics in UK, US, everywhere, okay? There may be some racism, but I think so your hard work overpowers everything.
Right, so it's not something I need to worry about.
No, there is nothing like that. Yeah.
Now that we are at the end of the video, thank you for watching it till here. I want Dr. Siddharth to actually tell us some good words, some wise advices that he collected in India, in UK, that will help us in the future.
Yes.
Anything?
Yes, definitely. My personal advice to everyone is that you have to take chances, okay? Firstly, there is nothing called as right or wrong decision, okay? Abhijit, for you as well, there is nothing right or wrong. If you do need PG, do it the best way, be the best doctor anyone can have, and totally surrender yourself in. You will be a very great person, and definitely you will achieve heights. If you want to do Plab, do it the best way, okay? Don't do Plab only because you don't want to do neet or any exam. I wanted to do Plab, that's why I'm doing Plab. I'm not doing Plab because I didn't want to do neet, okay?
It's not a second option, it's a choice.
It's a choice. I had my first choice as Plab now, and I can say that confidently that it's good choice. I feel that. Maybe 2 years ago, many people were pulling my legs. Everyone was saying, why the hell are you doing it? Because I didn't even know the full form of Plab before 2 years, right? So it's not that there is a right or wrong decision. Take your chances. Also, start working, I feel. Okay, whenever you have time, work anywhere. So, for example, Abhijit, he's making videos, he's interacting with me, like-minded people. He gets help from that. Okay, so don't restrict yourself to those books. Okay, I myself read a lot. That doesn't mean that I only restrict myself to books. There is a big world behind it, apart from that book, and you have to access that. Okay. Secondly, is we grow through what we go through. Okay, so very important line I feel is I have gone through the medical officer thing. I've gone through this research and development team in director in research and development in YCA, in the medical writing journal, clinical attachment, 2 clinical attachments, this Plab and everything. I have myself, I think, evolved as a doctor on the basis of whatever I've grown through now. Okay, so what I've went through all this thing, and I feel that I've become more confident as I was 2 years ago, only because I went through a process. So always respect the process. Whatever you have go through, see, there will be this ups and downs. Okay, for everyone. I had my share of ups and downs. I will have my share of ups and downs now, but at least I'm responsible for it.
Right.
I have the guts now to even face those ups and downs, because I am the only one who has chosen this pathway. If anything goes south, I am there to take all the blame, and I'll do something good in my life. The only thing that I feel is that you have to go through the process, and that is the most important thing.
Right. Take risks, take your choices, and be responsible for them. Thank you, Dr. Siddharth, for being here. If you want to connect to him, I share his Instagram link as well as his Gmail address right in the description. You can access to his notes, you can access to his advices. You can just message him about anything if you have any doubts for Plab. We may just set another session with him later on. If you want, just let me know in the comment section. We will be back with another interview someday soon. Thank you for joining in. This is Abhijit and this is Dr. Siddharth. We are signing out.
Thank you so much.